Today, the topic we are going to discuss is gait coordination problems. It feels like limping, tremor, or weakness to lack of coordination. Darkness, or trying to rise from a seated position can make it worse. People can feel unsteady on their feet if they experience dizziness when standing up. On your patient visit, you'll ask him about headache, tinnitus, weakness, or changes in sensation, tremor, joint, back, neck, or leg pain. You will want to know if he or anyone in his family has had any of these conditions: alcoholism, diabetes, any nervous system disease, chronic anemia, syphilis, cerebrovascular disease, cerebral palsy, arthritis or joint disease, hip disease, abnormal gait or coordination. Your doctor will want to know if you're taking any of these medications: barbiturates, tranquilizers, anticonvulsants such as Dilantin. You will do a physical examination including the following: blood pressure, checking muscle strength, watching him walk, testing strength, sensation, and reflexes. If the patient is a child, you will measure his range of motion in the hip and the length of his legs, and may ask him to stand on one foot or make a simple drawing. If a patient comes to you with typical symptoms like chronic problems, family history of muscle weakness, difficulty rising from a seated position, weak leg may waddle, or exhibit a flinging movement, sometimes leg, neck, or back pain, the patient might be suffering from weakness in the muscles controlling gait and coordination. If a patient comes to you with typical symptoms like stroke or compression of the spinal cord, incontinence, and mental retardation, the patient might be suffering from spasticity, which is muscle spasms. If a patient comes to you with typical symptoms like normal intelligence, but difficulty with challenging tasks, such as standing on one foot, threading a needle, drawing only in children, the patient might be suffering from minimal cerebral dysfunction, which is slight brain damage. If a patient comes to you with typical symptoms like stamping, gait, ankle jerks, usually worsens in the dark, sometimes history of syphilis or pernicious anemia, more common in people with diabetes, the patient might be suffering from sensory ataxia, which is lack of sensory coordination. If a patient comes to you with typical symptoms like tremor, headache, ringing in the ears, unsteady or wide gait, may result from alcoholism, genetics, brain tumor, or stroke. The patient might be suffering from cerebellar ataxia, which is degeneration of a part of brain that coordinates movement. If a patient comes to you with typical symptoms like resting tremor, difficulty starting movement, shuffling gait, poor balance, gradually worsens, the patient might be suffering from Parkinson's disease, which is a degeneration of a part of the brain that coordinates movement. If a patient comes to you with typical symptoms like limp, no complaints of limb pain, shortened leg, more common in female children between the ages of 1 and 3 with a family history of hip problems, the patient might be suffering from congenitally dislocated hips, which is due to hip problems present at birth. If a patient comes to you with typical symptoms like general lack of coordination and unsteadiness, he might be suffering from intoxicated gait, which results from alcohol intoxication. If a patient comes to you with typical symptoms like hip or knee pain, limp, more common in children between the ages of 5 and 16, he might be suffering from Pearl's disease, which results from problems in the head of thigh bone. He might also been suffering from slipped femoral epiphysis, which is separation of the hip joint from the thigh bone. If a patient comes to you with typical symptoms like feeling as if you fall frequently, staggering gait, rare injuries associated with other emotional problems, then he might be suffering from hysterical gait, which is psychologically induced walking problems. So that was all for today. Keep following sqadia.com for more such videos.